Today, through this video blog, I am going to share information regarding a common problem called piles. In medical terms, we call it a hemorrhoids. When we talk about piles, there are two types of piles. One is called as an internal piles, the other one is called as an external piles. The basic problem with piles is that the vein, which is a blood vessel in the body, gets big. So that is why you get a piles. When this happens internally, it is called as an internal piles. And when this happens on the outside, it is called as an external piles. So when we have piles, the common symptoms the patients would have is that they would complain of some uneasiness either in the anal region, they will complain of some itching, and the main complaints they will generally have is a swelling in the anal region, and they will complain of passing blood either mixed with stools or after passing stools. In addition to piles, another common problem which is present in the anal canal is called as an anal fissure. So people in our surroundings generally think whenever we have some difficulty, it is always related to piles. But we should always remember that this anal fissure is much more common than piles. And when we have an anal fissure, the common complaints the patient would have is a severe pain. They might have minimal bleeding because they have an ulcer in the anal canal, but the pain is the predominant symptom they would have. Why I am telling you this is, generally when we have a piles, it would be a painless bleeding which is present. Pain can very rarely come when there is a thrombosed piles or there is a small blood clot within the enlarged vein. But this is not common. So whenever you have pain, I think you should be more concerned about the anal fissure rather than worry about the piles. In addition to these two symptoms, the common cause for both these problems are constipation. So whenever we have a difficulty in passing stools and we strain a lot, we have the potential to develop either a piles or a fissure. So one has to be very careful that we do not develop any constipation or have it for a prolonged period of time and get it ready immediately. So what are the ways in which we can avoid a constipation? One has to take a lot of water, they have to take high fiber food, plenty of fruits and vegetables, and have a good healthy lifestyle. This would generally reduce the chance of developing a chronic constipation. So once you have these problems or you have a doubt whether you have a hemorrhoid, the next thing you should do is go to a surgeon for consultation. The surgeon would do an examination and then do a per-rectal examination, and if required use some special instruments to have a look into the anal canal, and after that he will tell you the diagnosis. You do not need any hi-fi tests or investigations required to diagnose a hemorrhoids or an anal fissure. So once you have the diagnosis, when it is in the early stage, we generally would prescribe some tablets or ointments to treat piles. And generally we would give you some laxatives to pass stools freely and some local anesthetic ointments to reduce the pain when it is a case of a fissure. And when it is in an advanced stage, only then we would recommend surgery. In fissures, we generally try to avoid surgery because it is a recurrent problem. You can anytime develop a fissure once again even after a surgery if you develop too much of a constipation. So generally we try to treat it with only medications and lifestyle modification. Whereas once you have a large hemorrhoid with active bleeding, you cannot treat it only with medicines, then you will definitely have to undergo surgery. Before doing a surgery though, we would recommend you to undergo something called as a sigmoidoscopy, where a small tube with a camera at the tip is passed through the anal canal and your large bowel is examined to make sure that there is no swelling inside. Because a lot of times a cancerous swelling can be the cause for constipation, and hemorrhoid would be the only indication which would present without any symptoms in the early stage. And after doing this, if we are for sure know that there is no growth inside the large colon, then we would suggest a hemorrhoidectomy where we would remove the dilated veins. And generally this will take care of the problem, and recurrence in the same area is not very common. But in the other areas, you can develop your piles again if you do not take care of your constipation very well. I hope this video blog was useful for you. If you have any more doubts, you can contact me at Ashwin Hospital. Thank you very much.